Hey guys, welcome back to Preview Alliance Podcast. It's Sarah
and Whitney,
and we have a special guest today.
Yay.
We got Emily here with us, Emily Gilmore. If you're in Birmingham, you should know about Thrive PT, okay? She is our go-to for pelvic floor therapy. Mm-hmm. And she is with us, and she's going to educate us on pregnancy period today, guys. So first off, I didn't know this. I'll admit this, what the pelvic floor was. Can you give us a little bit of like what it is and why we need pelvic floor PT?
Absolutely. So the pelvic floor is a sling of muscles that sits at the base of our pelvis. It has four kind of basic functions. We have bladder, bowel, sexual, and lymphatic drainage, and it's also huge in core stability. So it's a sling of muscles. They all attach to our pubis, our sit bones, and our tailbones and kind of serve all those functions. So they make the decision to keep things in and let things out and are also hugely influential with our core. So essentially we have a superficial pelvic floor layer that would be responsible for keeping things in. So this is what would keep us continent, that would keep us from peeing or pooping ourselves, but also needs to stretch at the appropriate time. So if we're having penetrative intercourse, these muscles would need to stretch at the appropriate time, as well as releasing our bowels and bladders when we choose to.
Yeah.
The deep layer is really responsible for kind of pelvic stability and core stability, and it actually is the floor of the core. So these are hugely influential muscles that are significantly impacted with pregnancy and postpartum, but also really important to note that we can have issues with these without being pregnant or being postpartum. They're just a part of the mechanical system. Okay. So because of these are normal muscles and they contract and relax with normal functions, we can have the same issues with these muscles that we have with any other muscles. They can be tight, they can be spasmed, they can be poorly coordinated, they can be weak, they can lack endurance. But because of what they surround, and they're, in charge of bladder and bowel continence, as well as sexual functions, most of our issues with these muscles present as bowel, bladder, sexual issues. And so we think I have a bladder problem, I have a bowel problem, I have a sexual problem, but actually it's a lot of the muscles that are surrounding these that are not contracting or relaxing at the appropriate time.
Okay. Yeah.
Interesting.
So then you grow a human. And things go left.
That's right.
They get very stretched out.
Yeah.
Well, the interesting thing is during pregnancy, they actually get kind of tighter.
Really?
Because hormonally, everything around our pelvis is spreading and our body's like begging for stabilization. Not to mention we have like a huge center of gravity change as we have this pregnant belly that's growing and growing every day. And so our body's like, help, my pelvis is spreading apart. And so sometimes during pregnancy, our pelvic floor can actually get tighter and cause some issues during that as well. So, there's some bad advice floating around out there during pregnancy that we need to do like 500 Kegels a day.
Yeah.
To prepare for birth.
I've heard that. Yes.
I don't know where that came from, but anybody who's listening, please do not do that.
Yeah. Okay. Tell us what to do.
Yeah. Right. So essentially when we think about birth, the pelvic floor has like the stretch of its life, right?
Yeah.
So it would stretch 2 to 3 times its normal length during birth. So we want our pelvic floor to be mobile. We want it to be able to kind of relax to its max capacity when we're talking about having birth. So a Kegel contraction, which we kind of all hear about, is when we kind of draw our pelvic floor up and in. So we're kind of shortening that space, tightening that area, which is kind of exactly the opposite of what we want.
Oh, okay.
Yeah. So we have been told to do the absolute wrong thing.
So now Emily is correcting this. Thank you.
Yay.
Everybody take note.
Yes. So, and again, like Kegels are kind of like the blanket advice that we hear for like any pelvic floor dysfunction.
Yeah.
Anything that you could possibly ever hear. People
And
are like,
nothing
I
against...
pee myself. People are like, do Kegels. And then we don't even know what that means.
A lot of doctors just throw that out.
Right. And I hate that.
Yeah.
Because like most people that are having issues with bladder leakage or gas control don't even do them right. So then we're just like doing bad Kegels all the time, and we don't.
So then it probably makes it worse.
It makes it worse, right? So can I take like 1 second and we talk about an appropriate Kegel?
Let's do it. Teach us.
Okay.
Get ready, Whitney.
All right, so
we're doing this.
I want us to think about the pelvic floor like an elevator.
Okay.
So our superficial layer is like we're going to shut the doors, right?
Okay.
So we get a squeeze, and then our deep layer is a lift. So we get a squeeze and a lift. We come all the way up, and then it's most important that we come all the way down. So some of us like just Kegel at the very top, and our elevator kind of gets stuck at the top. But it's just as important to come all the way down and fully relax everything. So we squeeze, we lift, we come all the way back.
And
everybody's probably Kegling right now.
How many times do we supposed to Kegel? Or
so like just kind of like a normally dosed exercise, like we would not do 500 squats a day.
Yeah.
Oh, Lord, no.
We would
My
not-
legs wouldn't work.
We would not do 500 bicep curls a day.
Right.
So, like, we do not need to do 500 Kegels a day. And I never recommend them, like,
Yeah.
blanketly.
Yeah.
Because if somebody is hanging out on the tight end of the spectrum and
Yeah.
maybe they don't have good length or they clench through their
Got
pelvic
it.
floor all the time, then Kegels make them worse.
Okay.
So,
Wow.
we can have issues like leaking because things are also too tight. And so if they're just Kegling, they're just getting worse. So appropriately dosed, because
Okay.
not everybody needs strength. Some people need length.
Yeah.
And I would venture to say with pregnancy, particularly with first pregnancies, we need length.
Yeah.
Especially in the third
Okay,
trimester. I'm like, you should not be Kegling at the red light. We should be talking about diaphragmatic breathing.
Got
We
it.
need to be doing pelvic floor stretching so that those muscles have the mobility to get out of the way.
Yeah.
Because really, like, it's not our pelvic floor's responsibility to push a baby out. Our uterus will do that,
Yes.
whether we make a decision to do it or not.
Yeah.
Yeah.
We have to create space.
Oh, I love that.
And the more space we have, the less we tear.
Yeah.
And see, I think that's just something that
Mm-hmm.
we talk about mental health this a lot. We're
Yeah.
just supposed to like know this naturally, right? And it's here with our pelvic floor. No one's telling you this in these OB appointments.
No.
Okay. Your friends are not honestly going to share this unless they've done,
Yeah.
they've had an issue
Right.
Yeah.
and they've sought someone like you and then they can
Yeah.
be a voice. But there's a lot of women out here, they just don't know.
Yeah.
Right. Well, and because, like, you know, so many things are changing in pregnancy posturally, you know, we can have some issues here
Yeah.
that maybe weren't there before.
Yeah.
And so people are like, oh, you know, sex wasn't painful before I'm pregnant and now it is. Why is it? I guess I'll just stop doing it.
Yeah.
Whatever.
Yeah.
But a lot of times that, you know, that's a muscular issue. Like those muscles are tightening, they're kind of
Gotcha.
adapting, and they can respond really well to treatment.
Yeah.
And it's important to kind of seek treatment during pregnancy because a lot of times we aren't like given a lot of options. And so like,
Yeah.
you know, a lot of the main issues we'll kind of see
Mhm.
mechanically. We see some back pain.
Yeah.
And that's especially with our moms who already have children because
Yeah.
they don't, you know, they clock a little less couch time. We're lifting a toddler. We're also don't have great core strength with our pregnant, you
We're
know,
putting
belly.
babies in and out of the crib
Yes.
and all that.
Yes. So, you know, we'll see some back pain, but then some pelvic girdle stuff. So some SI pain kind of goes along with that back pain in the back, this area right here. But this one, pubic symphysis or pubic pain is also a big culprit. So we can have like two big causes of this guy. The first one is the round ligament. So the round ligament will go from the pubis to the uterus. So this is what happens when people sit for a long time. They stand up and it's like, wow, lightning.
Okay. So
Got it.
I did not have it with Will and I had
Okay.
it with James, my second.
Yeah.
I remember I fell to the ground.
Oh, it's shocking.
I was like, and my husband was like, what is wrong with you? And I was like, there's lightning in my vagina right now.
Yeah.
And I just need it to pass. And he was like, do we need to go to the hospital? What is happening? And so I started texting my friends. I'm like, okay, why is my vagina
hurting
hurting and like it's lightning? And they're like, oh yeah, I had that with mine. It'll go away. Oh yeah, it's this. Or and I'm just like, I have to live like this?
Right.
yeah.
Well, and a lightning crotch.
Yeah.
That's the street name
Yeah,
for it. That's
yeah,
what people will
yeah.
call it. But you know, round ligament pain. There's some kind of easy things we can do for that. I mean, one of the easiest things that you can start doing right now to help with that is just slow your transitions.
Yeah.
So it's like quick sit to stands are going to be like, well, pow, right.
And that's what happened. I have a toddler, so
Yeah.
he's probably like trying
Yeah.
to kill himself. And I'm like,
Yeah.
up.
Yep.
Yeah.
There you go.
And even like rocking the pelvis back and forth a bit before we stand up, right? Like just getting a couple pelvic rocks, we get a couple
Okay.
easy stretches can really help with that. Round ligament pain is pretty benign, but
Mhm.
it can feel terrible.
Yeah.
Yeah.
Right. The other more like sinister cause of this pubic pain is pubic symphysis dysfunction. And that's this little disc here that connects kind of both sides of the pubis. So this area can really gap and spread and cause a lot of problems. And this would be more like, I can't put on my pants and stand on one leg. Stairs hurt. I go for a walk. It's
Okay.
hurting more as the walk goes on.
Got
And
it.
this is one of the things in pregnancy that I'm like, ooh, we got to be really kind of protective of this.
Yeah.
Got it.
Because this is
Yeah.
one of the problems that can get worse with birth and still be really debilitating postpartum. So
Yeah.
I'm like, if we identify pubic symphysis dysfunction, we can start treating it during pregnancy, get them
Yeah.
on the right exercises and external supports. And a lot of times they really benefit from like a little support belt.
Oh, okay.
You know, and usually people with pubic symphysis dysfunction, like I don't want them running
Okay.
because they get a lot of shearing in this kind of
Whitney's
midline.
a runner.
Yeah.
I am.
So,
Yeah.
like, you know, if they have this, I'm like, we need to talk about some other, you know, activities and doing some appropriate strengthening.
Now you mentioned like a supportive belt. What if someone used like KT? Would that help at all?
I would say like KT tape can be a little bit tricky in pregnancy.
Okay.
We use it sometimes, but
Yeah.
because like the belly literally changes shape throughout the day, they can be a little bit more prone to skin irritation. And like the
Okay,
pubic
got it.
symphysis can be
Yeah.
kind of tough just because there's hair and stuff there.
Gotcha.
And
yeah.
you know, ripping
that's
hair
true.
off kind of hurts.
Yeah.
Yeah, it does.
Some wax in the
Yeah, so
making
like,
there.
Yeah,
Yeah.
there you go.
We'll
Yeah.
try it, but I don't throw like all my eggs in that basket.
Got it.
Sometimes because if they sweat and the tape gets wet, you know, they can
Yeah.
get a little bit more irritated. Just different people's skin tolerate different things
Got
differently.
it.
And so
Okay.
sometimes having like a kind of reusable belt that they can use to kind of give a little
and
bit.
adjust as needed throughout the day.
Yep. And throughout the pregnancy can be helpful. The other kind of important thing to note about pubic symphysis dysfunction is a lot of times it kind of will be blown off as round ligament pain. They can be like difficult
I can see
Okay.
that,
to differentiate.
Yeah.
And so I would say if you're getting round ligament pain, you feel better as you get moving.
Okay.
You may have
So
that
almost
initial
in a
pain.
sense warms up. Like
Exactly.
A stiff
So you're, like,
muscle
stiff
It
and
kind of
getting going.
stretches out.
Got
It's that
it.
initial quick stretch gives you that pain, and then
Okay.
it kind of gets
Eases.
gets moving and
Okay.
it feels better. Pubic symphysis typically gets worse.
Okay.
So it's
Okay.
like I didn't have any pain when I started walking, and now I'm at the end of my walk, and
And-
I'm getting more and more
yeah.
pubic pain. And I think an interesting thing to note about this is that, you know, most of us in the U.S. deliver on our back,
Yeah.
but that actually gives us the most gapping of this area.
Oh, wow.
So if we're actually, you know, already having an issue with this area kind of excessively separating or being unstable, delivering on our back is the worst position that we could.
So
Wow.
for those mamas, would you recommend?
Yep.
Or okay, so
Either
like a squatting
sideline,
bar?
either sideline
Okay.
or an all-four delivery is more protective
Got
to the
it.
pubic symphysis and would reduce kind of maybe some postpartum complications
yeah.
that we could have with that. So,
Got it.
and those respond round ligament pain, pubic symphysis pain, back pain, SI pain, all respond great to physical therapy. And you're kind of limited on your tools in pregnancy because
Yeah.
like we can't take Advil and we
Yeah.
can't get injections.
Yeah.
And
Yep.
things are
No
kind of
Motrin.
stripped away.
Yeah.
Yeah.
And so like physical therapy is like a great way to manage your pain and as well as maintain your strength throughout your
Yeah.
pregnancy. So if we can like maintain strength, maintain
Yeah.
fitness, modify exercises, then that just, you know, puts lots of deposits in the bank for a better postpartum recovery.
Okay.
I think it's important
That's
to
awesome.
say is
Mhm.
like you can ask your provider
Yeah.
Yeah.
and say, I need to deliver this way. I'm going to try this
Mhm.
way.
Yeah.
You know, I need this opportunity. You can advocate for yourself.
Absolutely.
A lot of your OBs, your midwives, your doulas, they may not be well versed on the pelvic floor, on PT, on what you need.
Yeah.
So you can ask for referrals. You can go to your insurance and say, can you self-refer or do you need a referral?
Yeah.
In the state of Alabama, we can evaluate, but we have to have a referral for like a plan of care. But most OBs are like, cool, you want to do that? No
Yeah.
problem.
Yeah.
In most other states, you can walk right through the door and just get treatment.
So kind of just check with your insurance ladies, check with your state to see
Mhm.
what's going on, and having a, you know, OBs, love them. This is not their wheelhouse.
Right. I mean, because these are just mechanical issues. And
Yeah.
a lot of times, you know, of course, like bodies are changing, right? So
Yeah.
even if you're doing exercise and things before, but now you're like, I don't know what to do with this belly, I'll just walk.
Yeah.
You know, but like resistance training is important during pregnancy. I mean, it helps keep us strong. Having that muscular stability is really crucial to make kind of feel good, and especially for, you know, caring for other kids or
Yeah.
dogs or whatever.
Yeah.
You know.
Yeah.
All
And
the things.
So,
that we
but a
do.
lot of people don't, you know, just don't know how to change their exercise to accommodate for pregnancy, and so they're just like, well, I'll just walk, and I'm like, no, we still need strengthening. You know,
Yeah.
Exercise is very specific, and walking is not necessarily going to give us all we need to kind of keep our bodies strong.
Yeah.
Yeah.
When during pregnancy do you see most people come to you? Do you think there's a lot, like, is it third trimester or second trimester? Or, and then I guess another flip on that is when should they start reaching out to you?
Right. So, I mean, any kind of, you're a little more limited in the interventions that you can do during the first trimester.
Yeah.
Plus, like, people feel bad.
Yeah.
And most of the time, activity levels are not that high
Yeah.
during the first trimester.
Yeah.
Kids can barely lift their head off the couch.
Yeah.
So, like, most of the problems start to present in the second trimester.
Mhm.
When
Or
that
the
wave
third.
of energy comes in, the
Yeah.
nausea starts to
You
wane.
start
wane
moving, you get off the
more.
couch or leave
And-
the toilet.
And that's when we have more of a significant change in regards to kind of posture, and we're starting to get a baby
Yeah.
bump and moving
Mhm.
around that as well. And so I would say anytime a mechanical problem presents, you can start, right? So if you start getting back pain at 14 weeks, we have people start therapy then. Some people may not start till 30, right? Because they didn't start having pain until their third trimester. As far as kind of like preparation for birth, right? Because we think that birth is just like this intuitive thing that we know how to do, but it's really like a mechanical process that we could really benefit from some better mechanics and positioning options and things like that. So we offer some birth prep as well, right? That usually starts about 35 weeks.
And what's some of the things that we can tell our listeners that's practical for them? Yeah. Because they may not be able to find, you know, a great resource like you. Yeah. So I guess what is a couple of things they can do?
So as long as you're cleared by your provider, and most people are, as long as they're still kind of cleared for intercourse, because it's more gentle than that. I usually recommend starting perinatal massage at like 35 weeks. And so that can involve a finger in the vagina, stretching those tissues in all directions. We have to think about, you know, that area is going to have a 360 stretch.
Yeah.
Yeah, it is.
With a baby's head. And our muscles were beautifully designed to be able to stretch that a lot more so than other areas in our body. But it's nice if the first stretch doesn't occur with a baby's head.
Yeah. Yeah.
So if we can start stretching.
I didn't experience that, but that frightens me even just speaking of that.
So if we can start stretching that area, and it's not something you have to do like every day, even every other day is beneficial. And just there's lots of videos that we can link to this as well, but just kind of stretching, like one finger in the vagina, just kind of stretching that area, like we're going to widen that space side to side and down towards the rectum is where it's going to get a lot of stretching.
Okay.
I also recommend that people are kind of educated on different laboring positions because there's good benefit in changing positions. The more we're changing positions in labor, the more we're opening and creating space for our baby to want to be in a better position.
So y'all would definitely recommend the peanut ball then?
We recommend the peanut ball. I usually show people stuff. In standing and sitting in quadruped or kind of all fours or kind of leaned over. And then positions that they can also do if they choose to get an epidural. Yeah. Because, like, we think, you know, oh, once I get the epidural, I'm just going to nap, and then they're going to come in and they're going to tell me I was 10 centimeters.
No, that did not happen for me.
Yeah.
No, I am team epidural. Let me just say I loved my epidurals, but I did not sleep with my epidural.
Yeah. So, I mean, but there's still good benefit to changing position and, like, moving from side to side and moving the peanut around. And there's tons of resources out there as far as, like, different positions. And we're wanting to kind of change those every 3 to 5 contractions. Yeah. Which probably seems like a little more frequent than we would expect.
I remember my nurse was like flippantly and it was great because again I didn't have bad deliveries at all. And then she did the tug of war thing too. That was super helpful with my first to get her underneath my pelvic bone.
But if you don't have that type of nurse,
she was gold. Let me tell you, I'll sing her praises all day long.
I think the assumption is a lot of times like, oh, they're going to tell me what to do, right? And I'm like, we can't assume that.
They're not all created equal.
They're not.
And you know, that's where like having a doula can be really helpful.
Absolutely.
Because they can support and direct your birth and your positioning. I also think it's just helpful if people have things to focus on that are not like the start and the end of birth. It's like I have things to do and stuff to work on and positions. And again, we have tests that we can do to help create space. And if we have space, then babies want to do what they want to do. And so offering that variety and shifting through our pelvis is helpful.
Absolutely.
The other thing we focus on is appropriate breathing.
Okay.
Right. So like in the hospital, we're taught like one kind of push. 1, 2, 3, hold your breath and push it. Everybody's purple in the face. Right? But I like for people to kind of feel equipped with different tools and like, can we try more of a gentler push where we learn to kind of distend through our pelvic floor. So again, like most everybody is kind of familiar, at least with the word of Kegling. Some people are like, I think I'm doing it. I think I'm not doing it. But going the other way and like actively bearing down through our pelvic floor is a weird motor skill.
Okay. Yeah.
Right?
Yeah.
Where we're like opening the holes.
Yeah.
Right? Like most of us don't.
Like I'm trying to visualize
Yeah, I know. I'm trying to do it right now. Yeah.
So like I usually, and I want to try to teach people how to do that while they are not holding their breath. So I like to kind of cue like what I like to call like a big belly, hard belly breathing.
Okay.
So if they like have their hands on their belly and they take a big breath, they fill their belly up. Now can they like exhale and push their belly out more?
That's offset.
It's opposite, right?
Yeah, I was about to say I'm having to really put some mental effort into that.
And so, but I like that cue because like if you have an epidural, you can't feel anything down there. right?
Yeah.
But you can have your hands on your belly and know that if I'm exhaling and my baby's headed back up towards my spine, I'm probably contracting my pelvic floor and it's moving in the opposite way.
Okay, so I worked in L&D for several years, and I cannot tell you the amount of patients that said, I would push, and then next thing I know, baby just comes right back up. Oh my goodness, that explains so much.
So, and I can tell them, like, you can have your hands below your belly button. And you can feel your belly fill up with that good deep diaphragmatic breath, and then like keep it there and like get, you know, kind of like push out against your hands as you're exhaling, gives you that pelvic floor distension. So then instead of our babies trying to descend and we're contracting all these muscles, our baby's descending and we're opening.
We're pushing them out.
And it's really like,
light bulb moment over here, y'all.
And this is why we need to learn this now, because when you're in pain, people are yelling at you over you, not yelling, but like, push. Yeah. You're just like, I'm at my wit's end.
It's a little chaotic during the L&D.
You need to know
stage.
it.
Well, and if you can't feel it, we need strategies of like some other type of, and also watching, you know, not everybody's down to watch either.
Yeah.
Right?
Yeah.
And also like, what are we looking at?
Yeah.
What's happening? The whole area looks unreliable.
Yes.
You know?
Yes.
But like having a tactile cue of somewhere somebody can touch, that you can feel, that you can push out against is helpful. And practicing those strategies when we aren't in labor.
And calmish. Yes.
Yeah. So you're like, all right, I know how to distend. And I would say 9 out of 10, if I'm like watching a pelvic floor and trying to get a mom to learn how to move in that direction, 9 out of 10 respond with shoot the tampon out. So if I'm like,
okay,
move, like you're going to shoot a tampon out. They're like,
got it.
Oh, I got that.
Okay. Yeah.
That makes so much sense.
It makes it.
Right. And so it's that same motion of like, if you're going to like shoot a tampon out, that we're kind of looking for our, that's where our pelvic floor is kind of most coordinated.
So with do you have a question? Like, I'm just piggybacking off of this right now. And so with those mamas who felt like they pushed and then baby just came right back up, and that happens for an extended period, have you seen either more 3rd and 4th degree episiotomies with situations like that? And I've had several moms say that, you know, eventually their cervix swollen, so then they would end up with a C-section. Do you feel like there's like a connection between that tightening and baby coming back up and those kind of outcomes?
Well, you know, maternal research is really poorly funded.
Yeah.
I would concur.
This is a secondary soapbox,
yes,
right? So like we're not getting good research.
You're listening
about
out there to us funding
They
places.
are not funding it,
Thank you.
Which is ridiculous because we have an ample, never-ending patient population that
Right.
we could fund and draw
Job
research from.
security,
But
people.
we aren't, which is really frustrating.
Yes.
I would say anecdotally from my experiences of seeing women when they're pregnant and when postpartum, when they have good mobility and a good pushing strategy where everybody is like rowing in the same direction, they tend to tear significantly less. They tend to push for far less time. And we know that those two factors of like pushing for a really long time could cause more of the prolapse issues postpartum. Also, like if we're pushing for a really long time, baby starts to get distressed. That increases our likelihood of an instrument-assisted delivery. So vacuum or forceps, which are directly related to more extensive tearing.
How could it not be?
Yeah, and sometimes I wonder, like, is it just that there wasn't the mobility, like in the tissues? Like, did they have a tight pelvic floor maybe even before they got pregnant, and then like they, you know, were just everything was moving in the way that was kind of combating what wanted to naturally happen. So I would say, in my opinion, and again, I don't have like the research I want to back this up because it's poorly funded.
Yeah.
Throwing this hints in.
But I feel like if we had better mobility, if we utilized different positions that actually helped open the pelvis mechanically, like would outcomes be better? Because I feel like from a lot of our moms that we treat that we do this, like, man, birth outcomes are better. Like first time moms having only grade 1 or small grade 2. And pushing for less than 45 minutes.
I was going to say, what to you is an extended amount of time to be put?
I would say greater than 2 hours.
Okay. That's about right.
Which,
with the
I mean,
hospital.
And that's exhausting.
Yeah.
It is.
And I tell people too, I'm like, this breathing while you push, this is kind of like breathing the baby down.
Yeah.
Right? It's energy saving. If we start our pushing process with a 10 out of 10 full pressure push, that's hard to maintain for 2 hours. So if we can start with like a gentler version where we're like breathing and we're circulating good oxygen, we're kind of like breathing the baby down and creating space. Then at the very end, when like we need to get that baby under the pubis, we have gas in the tank.
to do it.
To do it. We haven't already been using 10 out of 10 pushes for 90 minutes.
Yeah.
Exactly. So it's like, don't start the marathon out at your quickest pace. Like, you want to finish the race.
Work smarter, not harder, ladies.
Absolutely.
We got to learn that early.
Right. And again, like, I feel like a lot of people are open to stuff if you ask.
Yeah.
Right. So it's like,
well, if they know it's an option.
Right. And so, like, I'll be like, ask if you can start inside lying, which you can do that with an epidural.
Yeah.
Or like if you, ask if you can start in all fours, because like sometimes if, they still have good movement in their legs, that, they'll be like, okay.
Yeah.
But like if you're on your back and the baby's like, headed towards the pubis, they're gonna be like, that's not a great time
to change position. Yeah. With my first, I remember we were doing tug of war, and that's when I started the pushing phase. And that was so nice to have that leverage to pull up and not be just like flat on my back during that pushing stage. And then it's like, once she got out from under that pelvic bone, like, I mean, it was like, sister is coming.
Yeah. Well, and that's, we expect that to be intuitive, but also like when we're on our back, we're laying on our tailbone, we're laying on our sacrum, and those are spaces that should have, at least 18 degrees to move out of the way.
Yeah.
But then we're just laying on them. Yeah. So then we're not taking advantage of any kind of backwards motion that we could have. And so even popping like a little towel roll under your sacrum, or a noodle, like a swim noodle, little piece of one, then it kind of allows that pelvis to kind of come like this, so then we're not just laying on all these tissues. They have room to stretch this way.
So I love that. Say, like, if someone in a hospital bed and they start out on their back and all the things, and then they start like actively pushing, and they're almost in like semi-upright, like somewhat seated position, so like they have an angle to them, is that more ideal of a pushing as opposed to just like laying? Does that provide?
I mean, I would think so. Yeah,
because I feel like that's what they did with my second daughter.
Yeah, because and like of course that's a little bit more gravity assisted as well. Yeah. So like gravity's gonna.
But I was still in the hospital bed, technically on my back in a sense. But I remember like I wasn't like laying down. Does that make sense?
For sure.
I think there's a lot here that it boils down to, you got to educate yourself. We're here to do that for you guys.
Yeah.
Empower yourself. Know to speak up.
Yep.
And do what's best for your body and baby. Now, baby distress, there's a lot of things.
I was about to say, we can't handle
the abnormalities. But if things are in your control and you can advocate,
and I would also say that there's just things you can do to prepare.
Yeah.
Like that we aren't just like hitting a run with never having stretched. We would train for a marathon. We would train for a race.
Do the same thing for
kind
labor.
Of physical preparation. And doing Spinning Babies has excellent.
Okay. They are fantastic.
They have free exercises that you can access on their website.
We'll link that, ladies.
To help with baby positioning and to help with hip mobility and back mobility, so that you have the range in your body, and you can work on all that stuff with your pregnant, and you can work on your pelvic floor mobility, and you can work on these breathing strategies. So that way we aren't like trial and erroring when we're in extreme pain during labor.
Yeah.
When it's game time.
Yeah.
When it's game time.
I mean, because, an athlete's not going to go to his race or his game. I've never done anything before.
And I think like some of the birth education classes out there, I mean, they talk a lot about what birth is and the process of it, but not like how to do it.
I feel like nobody taught me any of this.
And nobody talks about like, they have stuff in your room, like a ball or maybe a peanut, but not like how to use them or which positions you could use them. They're just like, you want to bounce on that? Like, I guess.
You're like, sure, I guess.
Yeah. So I think we have like a long way to go as far as like educating birthing people on like physical preparation that you can do for your body that can,
that can
help with better outcomes and make pregnancy more comfortable, because it doesn't just have to be this thing that we suffered through and then your baby's going to come out and it's going to be better. And there is some expectation that some mechanical problems, may get better. I mean, may get worse as the pregnancy progresses, and that may be the case, but that's not always the case. And sometimes they
have to
resolve and they can exercise better and they can feel better. And there's options out there, and a lot of times they're not always offered, but you can advocate and you can ask for them.
Finally, what for our C-section mommies? Because I had no choice. I was C-section for both. I knew that. Was there anything I should have done in pregnancy to prepare, to help?
Well, again, like Spinning Babies has exercises on their website for breech babies.
Mine weren't breached. I had no choice. I had placenta issues, pre-invasive. So, and then accreta. So I couldn't get it out. So, but I always felt like it was a major abdominal surgery that they're like, well, you're just going to recover it from it. So I didn't know what to prepare for.
Well, and I would say, like, if you know you're going to have a C-section beforehand, again, like working on hip mobility, working on back mobility, making sure like all those tissues are nice. Yeah. Abdominal walls kind of out.
Yeah.
And like having the appropriate tools at your disposal immediately postpartum.
And that's good. That's a good note. What should we have? Like tools, right? Like, is it
for postpartum recovery?
With their C-section, what would you pack? I mean, is it anything you can pack in a bag that these moms who maybe they're fixing to pack their bags that you're like, this is going to help you?
Yeah. Well, I usually recommend, like, if they end up having a C-section, I tell them to like ask for an abdominal binder in the hospital.
Okay. So I put that, I had a great nurse and she's like, you need this. I didn't know I needed it until she told me.
Yeah. Because again, controlling that swelling makes it a lot more comfortable. As well as that compression feels good and makes your trunk feel more
because supportive. I remember I stood up and it went boop.
Yep.
And I was like, oh boy, my organs are like at my feet. That's how it felt.
Yeah, right. I remember with both my children, first time I stood up post-delivery, I was like, oh, my insides are just going to fall out of my vagina.
Yeah.
And
I was like, they were just all going to, and again, did not have bad traumatic deliveries, but I was like, oh, I don't need my intestines to leave me. Like, you got to stay in, Would
you think the hospital should give this to the ladies, or should they put it in their bag or like go on Amazon and find one?
The hospital should have them.
Okay.
Like, they might have to dig them up.
Okay.
But I usually recommend, like, because, belly changes a lot during the first 2 weeks postpartum. And so I usually recommend that that they get the hospital one. There's a little more Velcro, a little bit more adaptability for when you're kind of rapidly changing size. And then when you get home, I like the C panty.
Okay.
So it's like a compressive pair of panties that you can wear, and it offers compression to the perineum, the abdominal wall, and it has a little strip for like a silicone scar strip.
For shipping time, ladies, if you know you're going to have a C-section, go ahead and look that up.
And I would say like a good ice pack, and this holds true for both vaginal and cesarean births, but like the gel ice packs, not gel like just corner peas.
Yeah.
Gel ice packs that are actually going to be colder. A postpartum recovery legging or short are hugely helpful as well.
So having that before you need it is always a good thing.
Yes, be prepared.
Yeah, but if you don't know you're going to have a cesarean birth and you go in and have one, we have Amazon.
Yeah, Amazon. We get, especially in Birmingham, it's right down the road.
That's right.
Order it while you're in the hospital, and it'll be on your doorstep when you get home.
I totally did that, Jared. But I was like, actually, I need this and these because you're up feeding anyways, right? So what do? We shop. But
2 a.m. purchases.
That's right.
Oh, I know. Well, Emily, we're going to bring you back, and you're going to tell us all about postpartum, because I think what we can take away from this, ladies, is we're going to link a lot of resources. Your Instagram, your business's Instagram, we'll do the Spin and Sisters. So if you cannot find a local pelvic floor therapist, that you can educate yourself. Instagram, the internet, YouTube's great. Knowing to advocate yourself, how you can do different positions, and start early. If you're noticing the pains, you don't have to live with it.
Yeah.
Ask to see someone.
Yeah.
So you can never go wrong with asking. And referral.
Absolutely.
And figuring out how to advocate for yourself. But we appreciate you so much.
Yay. Thank you for having me. It's a pleasure.
All right. Till next time.
See y'all.
Maternal mental health is as important as physical health. The Preview Alliance podcast was created for and by moms dealing with postpartum depression and all its variables, like anxiety, anger, and even apathy. Hosted by CEO, founder Sarah Parkhurst and licensed clinical social worker Whitney Gay, each episode focuses on specific issues relevant to pregnancy and postpartum. Join us and hear how other moms have overcome mental health challenges, as well as access tips and suggestions on dealing with your own challenges as moms. You can also browse our podcast library and listen to previous episodes at any time. Please know you're not alone on this journey. We're here to help.